Story number 4. Is cheaper healthcare really the answer? A story like this has been staying alive because it's a key talking point in the next election, and when you look at candidates like Elizabeth Warren talking about Medicare for all, Bernie Sanders, and what's interesting about story number 4 and what makes it important is there's been talks of this for years about which medical system works, and that's which work what was it the old way of the Medicare system. Now the reason why I looked at the story for what it is that some people are griping, saying that the ones who have the wealth, the money that can afford a medical plan, they're saying that the people who are poor, disadvantaged, not making a lot of money, not heavily educated, they're saying that they have better Medicare programs than them. So what you're finding out in this system is that some people are now starting to try to educate those who are less fortunate on how the medical system works. Now, this seesaw battle goes in two directions. This pendulum goes in two directions as usual, from left to the right, because it's showing you. Now, there was research done showing that more poor citizens, people in lower city neighborhoods, they usually play aggressive sports. And what they found out was that people who have maybe a little bit more wealth, there's a high probability that they will not allow their kids to play sports. Now, this is a hot talking point, because people want to know, is it because they don't want to pay the medical bills, and the people who are less fortunate or poor, they don't understand how the medical system works. So you'll see this story come alive in different manners. And then there will be talk about how to make Medicare cheaper or less as expensive as it is, deductibles, employers paying for their employees, medical programs. So this is a talking point, because there's some stories that made it in that you'll see that add a lot of fuel to this headline, and the reason why it's in the top 8. Now, Warren is defending her Medicare for all plan. Even though she's facing bipartisan fire, she is saying that she has found a way for the wealthy, the people who are the employers, to pay for this medical program. Now, the flaw in this system is the simple fact is that everybody needs a medical plan. But what they're asking is, should it be a right to have medical assistance? Or is it a privilege? Is it a right? Or is it a necessity? Or should it be mandatory? And then we saw this may be why the Affordable Care Act got passed, because you took it, you put a tax penalty on it for people that if they did not have medical insurance, then you pretty much said that this is a mandate from the government, almost like car insurance, that people had to have health insurance. Now this story has all the ability to be a top 3 story in the next few weeks, because you will see people homing in on these topics. Like, what happens if someone puts a tattoo on their body saying, "Do not keep me alive"? Or people want to kill their children, babies, abortion. This story is an amazing story. It has all the, I always say, the substance, the ingredients to whip up a good conversation, to be able for humans to understand that maybe some people don't understand the value of being alive. Maybe they may have some mental problems, and that's why this story is here. There was a new study that even showed lack of understanding about how weed affects people's mental health. We've seen all of these people from the left touting about how weed is a miracle drug, forgetting that it may have a problem or may affect their mental health. Then you may look at the right, which is pretty much conservative, saying, hey, the Bible says, like I even say this most of the time, some trees were not meant to be eaten off of. These are talking points, and this is why the pendulum continues to swing. Employers are scaling back their dependence on high deductible health plans because they're seeing that they need need workers. They need highly skilled workers, and they're pretty much trying to do their best to save their workers from having to face those, even themselves having to face high deductibles. Teen girls on birth control pills report crying more, sleeping too much, and eating issues. This has been a talking point for years from the right, saying what are these substances that they're giving little girls to control their hormones, or control their birth rate. What are they doing to these girls' bodies? Some of these girls start developing muscles. Some of them start getting bigger. So I mean that in a positive way. Like I say, I try to water this stuff down as much as possible, but this is the truth. This is what's happening when these girls are taking birth control pills. Some of them are getting shots in their arms, and they're starting to gain a lot of weight. This is what's really happening inside of the aisles of teen girls who are trying to have birth control or do not want to get pregnant. It even goes the other way when you talk about e-cigarettes. When you take a little bit further to the left, they're talking about Juul has knowingly shipped tainted products to customers, former executive says in a lawsuit. So even with e-cigarettes, people are doing things to their bodies, and they're doing it at a very young age, and they're not being schooled. Some of their parents may not know this, may not be heavily educated. This is why this story number 4, this is why people should be informed. Women are using marijuana to cope with pregnancy syndrome symptoms, and they're like nausea. They're even now the FDA is warning them that this is not a good tactic. Now, I have to put you in this new school state of mind. Some of these people have not been taught that marijuana is not good for you. So these young girls are using it to treat their pregnancies. This is why people need to be informed. This is why you need old school thinkers to be on the new school floor, because this is serious talking. These are serious talking points. Now, if the FDA is warning about the Food and Drug Administration, then something has to be done about this. Now, these are years of data, years of research, and now people are starting to understand why stories like these are so important. Nurse charged with murder after a man asked to help him die. Now, this is another thing that comes in Medicare and understanding people wanting to seek better treatments. Some people kill themselves. I know people remember the case of Dr. Kevorkian. Stories like this are not going anywhere. Legal marijuana could generate more than $132 million in federal tax revenue and 1 million jobs. This Medicare, Medicaid, these topics are creating so much buzz because they're showing people that you can either take if they're selling it on the black market, if they're smuggling it in, people are going to use it anyway. So you see it trickling inside of the legal, legit medicine aisle, and it's creating a ton of talk because people are making money off this stuff. Nobody knows what it's doing to the body, what it's doing to people's minds. This is serious talking points, serious topics. But if they were talking about it in the biblical days, when the scrolls were being written, obviously they must have knew something that we didn't know. These are definitely talking points that we all need to talk. Now, I've never smoked anything in my entire life, and I feel like I'm like $1 million. I go to the gym, I work out, I have to cope with things that happen to me in the military, but I try to keep myself healthy, stay away from drugs. So hopefully I'm showing you that the results could turn out a different way if you do not use drugs. Missouri health director tracked menstrual periods of Planned Parenthood patients. You can see what people will do to get data. It is very scary. Bernie Sanders yet to go into details about his Medicare for All. I do not know the results or how these stories are going to change the course of time. All I can say is that if they don't change the course of time for the better, then I think it may be wise to take heed on what this stuff actually does to the human brain and the human body. And if the doctors, if they are heavily involved in this type of system and they're not using this data for the greater good of the public, then we may have a system that needs to be reformed, restructured, and totally overlooked, maybe with oversight. This is why story number 4 is definitely a key story, because we're getting close to it's election season, and some people may be losing a job because of some decisions they've made on the medical and healthcare crisis. Here in the media with me, Brian Westward. It's my duty every week to give you the top 8 headlines and developing news stories. Not here to hurt you, just here to keep you informed. That's always been the goal. If I say something wrong, forgive me. I'm only human, but this is what I do. I go navigating story, double checking, checking the list and checking it twice, finding out which stories are naughty and nice. If you want to be a contributor, help out anyway. Doesn't take much. Check out the stories that almost made it in, did make it in. All you have to do is visit www.method8inc.com, method8in.com, where you can buy something, click on something, watch something, read something, or just sponsor a program. Like I said, I'm here for you. I stay in the middle. The news, the journalists, the people on the front lines, they deserve all the credit. They do most of the work. I just navigate, going through story after story, finding out which stories will help you. If you want to be a contributor or help out in any way, check out all my sources on the website. Doesn't take much. METHOD, the number 8, INC.com, method8inc.com, where you can buy something, click on something, watch something, read something, or just sponsor a program. Every little bit counts.
Have no fear, fellow citizens. The Mediator is here.